is Bart Walker, and I am a general contractor. I deal with a lot of different people every day with my occupation. It got to a point where I was in need of implants. I started missing teeth. I started making self-conscious of my smile. I didn't want to open my mouth to anybody. It was getting hard to eat food. I just got to the point where I was in need of implants. I did go out to a lot of doctors, especially on advertising, commercials. Went to a lot of doctors and got x-rays, and everybody was trying to tell me to do all on four. Not too many options they were giving me. They just wanted to do one procedure with me, and I was kind of all for it. I don't know anything about the implants, so I was convinced that was the way to go. I had made my mind up to go with a doctor in Sherman Oaks. I got a phone call off the wall just from here. I guess I went online and left my phone number, and one of their lovely staff here had given me a call and was checking on me to see what I was doing. And I already told her I was made my mind up. I was going to the doctor in Sherman Oaks to do the all-on-4. So she kind of told me about the procedure, which nobody else even told me the procedure of all-on-4. So she told me that they're going to do some cutting of my jaw and started telling me all these details. She said, just come in here and give us the opportunity to talk to you and show you what we have to offer you. And let's see if you really need, the all-on-4, if you can, we can do anything different. So after coming in here, after all the x-rays, which they took so many x-rays, much more than anybody else did, I was told that cutting my jaw and doing the all-on-4 was just not the way to go for me because I had good bone structure. So they showed me another option, which I actually have 14 implants in my mouth right now. I have three sections of teeth going all around on different implants, which kind of takes pressure off of other, implants as I'm eating, or a much better system to go with. I felt that they were, showing me. I was getting a lot more for my money here. I was just so much, satisfied with that. And everybody here was so much into my health, my well-being, and what's going to happen with me during and after. I was so convinced this is the place to go to. So after deciding to go here, I was scheduled for a surgery date, which I was kind of a little nervous. Well, nervous about surgery and all that, but then they told me about this oral sedation, and I was a little confused about that and more curious about that than being nervous about the procedure. First of all, they picked me up, had me brought here to the office at about 9 o'clock in the morning. I was put in the chair, and they made me very comfortable and kind of relaxed me, and this is a very relaxing and warm place to be in the first place, so there was no problem with that. They gave me this little pill, and that was the most biggest thing I was curious about. You're going to put a little pill under my tongue, and that's going to put me out for the day and then doing surgery. So they gave me this little pill. I sat there and waited and kind of made some jokes and just looking at the screen and just kind of waiting. All of a sudden, the next thing I knew, I was waking up about 4 o'clock in the afternoon. My surgery was done. They made sure I was I was relaxed and awake, and then they took me home. So from that morning to the afternoon, they took care of my whole well-being, which really got to my heart. So after that, there was, I would have to say my toughest part of the whole surgery was just going home and recovering. I had a little bit of problem with just eating with my antibiotics. So that was the biggest thing I had, was just getting a little sick on the after, recovery a little bit. The surgery was nothing. It was just so relaxing and easy to go through that. It's just getting through the healing. And to find out after everything I went through and looking more on the 4-in-1, I was very happy I went this direction. They were all about implants, the bone grafts, everything healing, being solid. They wanted everything to be totally, healed. After that, they fitted me for dentures, which gave me months of being able to eat. If I was going to put any money into this, especially with my teeth and my mouth being the beginning of my health, I just felt money worth the cost. So just do the right thing and the best thing I had to do, for myself. Not so much for my budget, for what I wanted. I wanted permanent, solid, not have to worry about teeth at all. And that's where I'm at right now. I don't have to worry about nothing. My teeth don't go in a jar, they're in my mouth, they feel so normal. I can eat anything I want.